Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Pediatric Post-operative Instructions. Introduction. You are here in the hospital because of a surgery that resulted in the need to stay at least overnight or maybe a few days. This can be a very scary time for you and your parents. This program is for children and their parents. It will help you understand what to expect and what will be expected of you in the next few days. Your healthcare team. The hospital can be a strange place to a child. There are many confusing sights, sounds, and smells to take in. Many different people must work together to take care of one child. You may see a doctor or two, several nurses, a housekeeper, a dietitian, X-ray and lab technicians, therapists, and transporters. Together they form your healthcare team. Some people you will see wear scrub uniforms, some wear white coats, and others may even be in plain clothing. All of them, however, wear a name badge with their picture on it so that you can tell who they are and that they work at the hospital. They should also tell you who they are and what they do when they come to your room. To check on how your body is doing, the nurse will take your temperature, your pulse, and your blood pressure. Your healthcare providers will listen to your heart, lungs, and belly. To help you get well, they'll use many different kinds of equipment, such as stethoscopes to listen to your heart, lungs, and belly, BP cuffs to take your blood pressure, thermometers to take your temperature, oxygen masks to help you breathe, IV tubes to give you medicine. Your healthcare providers may even need to take pictures of the inside of your body using a big piece of equipment, such as an X-ray machine. An IV is a special kind of tube that is used to give you medicine and fluid directly into your blood. It stays on your arm until you can eat without getting sick. If you need to have a new IV put in, your nurse will try to use a special cream or medicine to make your skin numb so that you don't feel pain when it goes in. A small needle may also be used to take a little bit of blood. Healthcare providers need to test your blood so they can learn more about what is going on inside your body. Whatever the reason, it does hurt a little to get stuck by a needle, and you have the right to complain, cry, or say what you feel. The nurses will be happy to listen to you. If you have a broken leg, you might be taught to use crutches or a walker. These are pieces of equipment that help you walk until you can put all your weight on the injured leg. Privacy. There are times while you are in the hospital that you will need to wear a gown with no underwear. You will need to let your healthcare providers see the parts of your body that were injured or operated on. There is not much privacy in the hospital. Nurses may help you take a bath or wash you up in bed if you are too weak or tired to get up. They will do their best to close the door and give you some privacy. Your parents can also help with this if it makes you more comfortable. When the nurses and doctors say it's okay, you can wear underwear and maybe even your own pajamas if your parents bring them. If anyone who works here does something to embarrass you, it is okay to tell them or your parents so it does not happen again. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Controlling pain. Your nurses will ask you a lot if you're in pain. You're the best judge of where and how much it hurts. Talking about your pain with your doctor or nurse will help them find a treatment that helps you to feel less pain. When talking to your doctor or nurse, show them or tell them where the pain is. This is sometimes easy to do by pointing at the pain site, but sometimes it is difficult to locate the pain exactly. Tell your doctor or nurse if the pain travels or radiates anywhere else. For example, you might tell your nurse, the pain starts on my left side and spreads over to my right side. Describe your pain. Here are some pain terms to learn. Click on the term of your choice to get a definition. Cramping pain, sharp pain, shooting pain, stabbing pain. Tell your nurse about any other discomfort that comes with the pain, such as, I feel sick or I feel dizzy. Pain scales. In order to treat your pain, your doctors and nurses need to know how much pain you have. Unfortunately, pain cannot be measured in pounds or inches. Your pain can only be measured by you. To help you with this, the nurses will show you some pain scales. One of the scales rates pain from 0 to 10. In this scale, 0 is no pain, 5 is tolerable pain, and 10 is the worst pain. The numbers in between help you explain the amount of pain you are experiencing. Sometimes the scale is not only given in numbers but also in faces. A smiling face is a 0, or no pain, and an angry face is a 10, or lots of pain. This scale is usually helpful for children. Patients are also often asked what level of pain they can put up with without needing medication. This is called the comfort zone. Most patients' comfort zone falls around a 2 or 3, but this varies from patient to patient. There are no right or wrong answers. Your healthcare providers will order different medications for you based on the amount and type of pain you have. The nurse will give it to you when you tell him or her that you are in pain. It is also important to tell your nurse when the pain comes back. No medicine lasts forever, and if you wait for your pain to be too much for you to bear, it will be hard to control. Activity. At some point after your surgery, even as soon as the same day of surgery, you'll be asked to get out of bed with the help of a nurse or physical therapist. Walking as soon as possible helps you get healthy and avoid complications. Depending on what part of your body you had surgery on, this may be uncomfortable for you or even hurt. The nurses will offer you pain medicine before you get up and will show you ways to make it hurt as little as possible. Your nurse will help you get up to go to the bathroom and to walk in the hallway. Take your time and tell your nurse if you're having trouble. Your parents may also be able to help you with this. If you need crutches or a walker, the physical therapist will help you learn how to use them correctly and may teach you how to go up and down stairs as well. Diet. When your healthcare provider thinks your body is ready to handle food without you getting sick, a food tray will be ordered for you. They may start by feeding you foods you can see through, such as jello, broth, and juices. This is called a clear liquid diet. If you do okay with clear liquids, you may have soups and thicker liquids that are a bit more filling. This is called a thick liquid diet. Your healthcare team may decide you can go straight to a regular diet. This will not necessarily be a diet that you are used to, and will probably not include things like pizza and burgers right away. Once you are placed on a regular diet, you will get to select from a menu. If you don't see what you want on the menu, ask. Some things can be made for you, such as sandwiches. If you're hungry between meals and your doctor says it is okay to eat, you may be able to have ice cream, popsicles, jello, or crackers, as well as some juices and milk. Just ask your nurse. If anything you eat makes you sick to your stomach or you feel like you're too sick to eat, please let your nurse know. You may need to take medications that will allow you to eat. Entertainment. It can be very boring to stay in one room and not run around and play. There are things that you, your parents, and your nurses can do to keep you busy and help you have fun. There is a television in your room for your use. Your parents may want to help you choose a show that is appropriate for you. Ask your nurse if the hospital has a VCR or a DVD player that you can use while you are there. If they do, your parents may be able to bring your favorite movie for you to watch. If you like to color or draw, a nurse may be able to supply you with pictures and crayons or pencils. Ask the nurses what they have available. If your parents want to bring in a battery-operated game, please check with your nurses first. Some hospitals may not allow them. If you have any computers or video games with you at the hospital, make sure you have it near you at all times so it does not get lost. Ask your parents to bring your favorite book or magazine. If you forget to bring one, ask your nurses. They may have something for you to read. Depending on your health conditions, your friends may visit, but there may be restrictions. Ask your healthcare team about the hospital's visitor policy. If any of your friends have a cold or flu, they should not visit you. They will make you sick instead of cheering you up. Home care instructions. You will have to be healthy before you can go home. You need to be able to eat or take in liquids without vomiting, urinate on your own, walk with or without assistance unless your injury requires you to use a wheelchair, have your pain controlled by medication. Your healthcare team will decide when you are healthy enough to go home. Before you leave, they will give you instructions on how to take care of yourself at home. These are called discharge instructions or home care instructions. The person who will help you prepare to go home is often called a discharge planner. He or she may be a nurse or a social worker. The discharge planner will help you and your parents plan for what you need at home. A physical therapist may also work with you to plan for any special equipment you may need at home. Tell your discharge planner about any concerns you have about when you are at home. For example, if your bedroom is upstairs in your house, tell your discharge planner. If there are too many stairs for you to manage, maybe you could sleep downstairs for a few days. Otherwise, the physical therapist can teach you the easiest way to get up the stairs. On the day of your discharge, your nurse will go over your home care instructions. Remember to speak up and ask questions that you may have. You will pick up any medications you need on the way to the car, or your parents can pick them up for you. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. You are here in the hospital because of a surgery that resulted in the need to stay at least overnight or maybe a few days. The hospital can be a strange place to a child. There are many confusing sights, sounds, and smells to take in. Many different people must work together to take care of one child. You may see a doctor or two, several nurses, a housekeeper, a dietitian, X-ray and lab technicians, therapists, and transporters. Together, they form your healthcare team. Your nurses will ask you a lot if you are in pain. You are the best judge of where and how much it hurts. Talking about your pain with your doctor or nurse will help them find a treatment that helps you to feel less pain. In order to treat your pain, your doctors and nurses need to know how much pain you have. You will have to be healthy before you can go home. You need to be able to eat or take in liquids without vomiting, urinate on your own, walk with or without assistance unless your injury requires you to use a wheelchair, have your pain controlled by medication. Your healthcare team will decide when you are healthy enough to go home. Before you leave, they will give you instructions on how to take care of yourself at home. These are called discharge instructions or home care instructions. On the day of your discharge, your nurse will go over your home care instructions. Remember to speak up and ask questions that you may have. Thank you for using Explain.